Obesity is a real tough condition to treat in the clinical setting. We all know how hard it can be to lose weight, especially when you don't have a lot of time at your disposal. Diet and exercise are pretty central to how it should be managed, but the long-term outcomes of diet and exercise focused intervention is sometimes disappointing. What works really well is bariatric surgery, but these are invasive procedures that are usually limited to people at the higher end of the BMI spectrum. So for a long time, the treatment options that were available in primary care were, let's say, disappointing. But this is one domain of medicine that has seen a lot of progress over the last few years. As of today, Health Canada approves 3 meds for the treatment of obesity, the oldest one of them being orlistat. This does work sometimes, but patients don't always tolerate it very well, as it does have many GI side effects. Contrave was another addition to the therapeutic arsenal, but I think the treatment of obesity was really revolutionized when Health Canada approved liraglutide, or Saxenda, for the treatment of obesity. Finally, we had a med at our disposal that was really effective, with success rates going as high as 95% and much better tolerated than the other two. The two downsides being it's pretty expensive, but then again, so are the other two, and that it's a once daily injection. For some patients, well, this is a deal breaker. Some people tout semaglutide as a better version of liraglutide because it's just as effective, if not more, for the treatment of diabetes, but with a once weekly injection. So even those who are on the fence about having to poke their bodies with a needle, well, with semaglutide they only have to do it once per week. But does it work for the treatment of obesity as well as it works for diabetes? A quick search on PubMed will show you that this is an active area of research with some interesting papers out and others pending. We're finally starting to see some early encouraging signs, though Health Canada has not yet approved it. So what do you guys think? Is this the turn of the tide?